Hello, I'm Emma Howard and I'm joined by Dr. Jonty Heaversedge, who's an expert on men's health problems. Hello, Jonty.
Hi, Emma.
I've got a question here from a young man. He's turned 26, that's young to me anyway, and generally he says, I'm very athletic, but recently I found it hard to keep the weight off. Now he wants to know if this could be the symptom of a serious health problem.
Okay, so the first thing is it a serious health problem, isn't it? And actually the answer to that is almost certainly not. As a doctor, I'm much more worried about unexpected weight loss than I am about unexpected weight gain.
So loss would herald a serious weight problem, not a serious weight problem, a serious health problem.
Potentially a serious underlying problem if you lose weight unexpectedly. But gaining weight is much more likely due to changes in lifestyle. And I guess, you know, he's 26, you know, with age, a lot of things change. We tend to start taking a little bit less exercise.
Because he might not notice, of course. I'm imagining a 26-year-old man who thinks he's quite athletic. Maybe he's drinking more than he realises he's been doing.
Absolutely, and developing a bit of a beer belly, and that happens to all of us. You know, with age, it does get harder to keep the weight off, I'm sure. And I think that's right. Alcohol is a real issue for men, particularly in trying to just keep within the limit, because realistically, it adds a lot of calories onto your diet. So perhaps that's something that he could that he could try.
Now he's getting on the scales. He's seeing his weight go up. But if it's alcohol related, would the weight sit mainly on his tummy? A lot of men carry their beer and their wine there, don't they?
They do, around their tummy. They get that sort of overhanging bit over the belt.
Should he be measuring that?
That's really important. I mean, if he goes along to see his GP or his practice nurse, they could check his body mass index, which is a good indicator of whether he's become overweight. Because obviously he may have been underweight in the first place if he's very athletic, and his weight may be absolutely within the normal range right now. But the other thing we're encouraging men to do is to use a tape measure and measure around their waist, not where all men measure their waist, which is around their, belt line, but more a sort of Simon Cowell belt line, you know, up around your belly button.
Up by the tummy button.
Exactly, up by the tummy button there. And actually we know that if your waist around the middle there is over 37 inches, then as a man you're more at risk of cardiovascular disease, which is strokes and heart attacks later on in life. So absolutely, I think he could certainly check to see whether he's in the normal range or not.
But on the whole, he sounds pretty healthy to you, doesn't he?
Yeah, he does, absolutely. Just watch how things kind of slip. I mean, it happens to all of us.
Good advice, Jonty. Well, if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.